Welcome to Healthline 3. I'm Jade Balaxa. We're talking about new treatments in prostate cancer and the importance of screenings. Joining me now with an in-depth look is expert Dr. Gerard Henry with Willis Knighton Advanced Urology. Thank you so much for being here, Dr. Henry.
Thank you, Jade.
Well, tell us, what is prostate cancer?
Prostate cancer is a male cancer disease. Typically occurs in men over the age of 50. If you have high risk, like family members, you should start getting screened at age 40. But typically it's older men. It's the #1 cancer in older men in this area by far, not even close. And usually if we catch it early, we can do some pretty neat new stuff to treat it.
And so tell us, how does one get screened for prostate cancer?
Well, typically, like I said, high risk patients, age 40, once a year, blood work, physical exam, and then we just watch the blood work typically and see if it jumps up. And if it jumps up, then we move on to a prostate biopsy if that's indicated. We have some other studies too, like we can look at DNA in your urine. These are all new techniques, new technologies jumped up, and we now have, I'll call it, non-invasive treatments for prostate cancer if we catch it early. So like most cancers, if you catch it early, you have good results.
So definitely say if your dad, your grandfather has it,
brother,
that's definitely a risk factor,
oh,
right?
Yeah.
Okay. So tell us, you guys have some new prostate cancer treatments. Let's talk about that for a little while.
Yeah, this is exciting.
Okay.
The technology's been around for 20 years. It's been mainly in Europe. They've made, this is the third, I'll call it, addition, revision, and it just got approved by the FDA and Medicare a little over a year ago. And what it does is sends sound waves from different areas, and where they meet together melts that little tissue area. And so imaging has gotten so good over the last 15, 20 years that we can do an MRI of the prostate. We can kind of tell where the worrisome area is. We biopsy that, make sure it's cancer, and then if that's like the only area, then we can't, and it's lower grade, we will use the sound waves, ultrasound waves. So non-invasive, you understand? No bleeding, nothing. Sound waves from multiple areas come together, and where they meet, it melts it like a magnifying glass, melts like a spot on the paper in the sun. And it's, I tell patients it's like playing Battleship. I'm back at the computer, Star Trek, and I tell the computer where to melt the spots, and it melts the spots, and that's it.
Just like that.
Just like that. And it takes about 35 to 40 minutes outpatient.
And is this the machine?
Yes.
Right here.
Fantastic.
Tell us about the video we're looking
You're looking at the video. This is a robot, truly a robot, and you're seeing the robot arm, and that little area at the very end, kind of the concave area that's black outside the silver, is where the sound waves come. The patient lays down on the table. Like I said, I'm at the computer. I'm at the computer screen. There's the table. You put the rectal probe in. It goes in, and that's because it's right next to the prostate there. And then the imaging occurs. So here we go. Oh, this is fantastic. Look at that. So you can see us imaging the prostate. We've already biopsied it, got the MRI, know where we want to treat, and there's the images. So I tell the computer where to treat. And so I can look at the MRI images, I can look at the live images right there during the surgery, and here you go. Isn't this fantastic?
Yes.
So that's the area I'm going to treat. I usually treat more than just that area, the whole area, give a wide margin. And like I said, it takes about 35, 40 minutes, and I melt that whole area. And usually patients have almost no side effects. They don't even know anything's done. It's outpatient. Come in, get it done, leave. You have to wear a catheter for a couple days because that area of the prostate's melted. You want to make sure you can empty your bladder. But that's usually the biggest complaint, is just having the catheter in. It's fascinating. I like it. It's a quality of life procedure. It's not as powerful as, say, radiation, the proton beam that's available at Willis Knighton, or surgery where you remove the entire prostate and tissue around it. But if we catch it early, low grade, low volume disease, and we can treat it with this. What's interesting, I thought I'd be doing mainly guys in their 70s, because there's a whole bunch of guys with low volume, low grade disease in their 70s that I thought I'd be treating. But what's interesting, it's guys in their 50s, because they are looking at they're getting online and finding out the best treatments. So it's these younger, healthier patients that are getting online, seeing it, and then choosing it. And I need to somehow, like this show, educate guys in their 70s who we catch the prostate cancer early and treat them.
Oh yes, it's so important to do this and bring this topic to the viewers. We have Gladys on the phone right now. Gladys, what is your question for Dr. Henry?
My question to Dr. Henry, what is a non-invasive treatment for prostate cancer?
Okay, that's perfect. That's what I'm talking about here. It's called Focal One. You can get online, or you can go to our website on the Willis Knighton website, or just put in Focal One prostate cancer in your search bar for Google, and you'll get to see it. But as you just saw the video, it's a non-invasive treatment where you put the probe in that sends ultrasound, and where the ultrasound comes down, and that spot, it melts, and then we treat 250 spots. And it's a technology breakthrough. It's really cool.
Yeah.
And patients like no side effects, Gladys.
That's pretty amazing.
F-O-C-U-S?
What's that?
How do you spell it?
Focal, F-O-C-A-L space 1, O-N-E. So just Focal One, like you're focusing in on one spot. And that's what we do. We treat that area, and typically we'll re-biopsy, make sure there's no cancer about a year later.
Wow.
So that's the follow-up.
You got that, Gladys? Okay, good. Good.
Thank you.
Thank you.
Thank you, Gladys.
So are you seeing good results with it?
Yeah, patients, I mean, like I said, the patients are coming back, first of all, no pain, not having any side effects. I should probably bring a patient on and have them talk about it.
Yeah, we could do that another show.
And yeah, that'd be
talk.
great. And so I usually check that blood test I was telling you about earlier. It's called PSA, prostate specific antigen. And usually, in my mind, even though you're not treating the whole prostate, you're just treating that one area, it cuts it in like 2/3 usually, and we're all happy. And but we still have to check it 1 year later with the biopsy, make sure we didn't miss a spot, like say like another area, because I'm only treating about 1/3 of the prostate, not the whole prostate.
Yeah, the follow-ups are important.
Yes.
So tell us, what are some of the advantages of Focal One for the prostate cancer? Let's go over that.
One, think about something that's simple and outpatient. 2, essentially almost no pain, discomfort. 3, I mean, it melts the area where the cancer is, doesn't treat the other areas. Some of the other treatments, and they're more aggressive, and I'm not saying that they're not better in terms of cancer treatment. That's why we have to catch it early, small volume, low grade disease, cause some other troubles like erectile dysfunction or leaking, and that's just part of the deal with others. But with Focal One, you treat just that area, and hopefully they don't have any side effects. Of course, it's the weakest tool in the shed too. I mean, it's definitely less aggressive and less of a cancer treatment than those others. But that's why you have to do low grade, low volume disease.
So this is someone who is able to screen and catch the cancer early.
Right. That's why we're talking about screening too. We want to, just like almost all cancers, you want to catch it early, and so when you catch it early, this is a good option.
Absolutely. What is the recovery time for Focal One when someone has this type of treatment?
Sure. So they come in, it's an outpatient surgery center. It's at Willis Knighton Bossier Pavilion. There's an outpatient surgery center, that's where I go. And patient usually is there for 5 hours. My part is 35, 40 minutes usually. They leave with a catheter, because I told you the prostate's kind of melted. I usually ask them to take it easy for a couple days, but you realize there's no bleeding, there's no incision.
Yeah.
I mean, the biggest
that's
thing
a lot
is
of good benefits.
IV. They get an IV, of course, because they're put to sleep. You can't move while I'm treating you. And yeah, you have to go to sleep, and so you have to wake up. But yeah, you walk in, walk out same day.
And we have Gerard on the phone right now. Gerard, what is your question?
Yes, on a prostate. Why do you have to have a prostate?
Okay, the question is, as I understand, is why do you have to have a prostate? Okay, prostate is a reproductive organ. It's where your ejaculation comes from. So here's your bladder. Right underneath it sits your prostate. You urinate through your prostate and on out. Well, your prostate is where your ejaculate comes from for reproducing. So that's why you have to have it.
Yeah, that's a great question.
Yeah.
Well, I don't need mine no more, so why should I have it? I mean, I'm 76 years old.
Well, I mean, we don't need to, if it's not causing bad things, we don't need to do a surgery on you unless it's causing problems. So, but you're right.
No.
You're right. In some ways, you may
I've been
not
having
need it
trouble.
anymore, but it's like your appendix. You know, like the little thing that can cause troubles in your belly is you don't need that ever, but it can cause problems. And if they're causing problems, then you would do it. But otherwise, you just leave it alone.
Well, I've been having trouble for about 10 years with urinating a lot at night.
Well, come see me. I'm happy to help out. That's one of the things I treat is troubles
Okay, you're in
urinating.
Bossier?
I'm in Bossier and in
You're in
Shreveport. I'm at Piermont, Wilsonite and Piermont in Shreveport, and I'm at Bossier and Bossier.
Okay. All right, because I go to Piermont.
Yeah, I'm there all day today.
All right,
Okay,
yeah.
Thank you.
Thank you.
Thank you, Jared. Yeah, some great questions there. So, tell us. You said this is outpatient. Does someone need a referral to come see you, or how does that all work out?
It's most patients are seeing their family doctor or primary doctor. They may have that blood test I was telling you about. PSA may go up, and if they do, then they would send a referral to me. You know, like another thing is. That's like what Jared was talking about, like if you have troubles urinating and the medicines for that don't work, then the primary care doctor refers them to me, and then I address those issues.
Okay. Larry, good afternoon to you. What is your question for Dr. Henry?
Hello, Dr. Henry. Thank you for this information. I think it's truly amazing. My question, though, is that I'm 72 years old, and I know a lot of people have a lot of trouble with chemotherapy, and I was just wondering if this kind of treatment could be used on other forms of cancer, too.
Okay, great question. Yes, I've been asked this in clinic, Larry. Is this going to be used in other cancers? Well, again, this would have to be used early on, you know, while the cancer is still small. Chemotherapy usually is used for when the cancer has spread, you know, later advanced disease. So if you catch it early, they are looking at it for other cancers already. They are researching that. It's not FDA approved for it, so it won't be easy to get done here in the United States. But yeah, I know that they're looking at it for like breast cancer and liver cancer and things like that, to my knowledge. That's what I've been told.
It sounds like
Okay, well, that's wonderful.
Thank you, Larry.
Yes, thank you, Larry, for calling. We appreciate it. It sounds like that it's something that you're really excited about.
Yeah. Well, like I said, I mean, who wouldn't want something that's non-invasive, in and out, doesn't affect quality of life? I mean, that's why I tell it's like Star Trek. I'm back at the computer and you're laying on the table. So, yeah, and I also say battleship, like the game, because I tell the computer where to treat. So that's kind of a fun way to describe it to patients.
So when someone comes in to get Focal One, kind of walk me through the process of someone coming.
Well,
okay, you've agreed
I'll
to
go
do
through
it.
the normal
procedure.
pathway. All right. So patient has the elevated blood test, and we got a couple little special tests like urine and blood tests that we can determine if it's more cancer or not. And if we decide that it's more likely chance of having cancer, then we would do a biopsy. And so we would get the biopsy, we'd go over it together, and if it's more aggressive, I would send them on for proton beam, or if they're younger, I would send them for radical prostatectomy. But you know, that's if it's more serious. If it's low volume, low grade disease, I would then talk to them about Focal One. I have brochures on it. Actually, a fair number of other urologists in the area have sent me their patients who have this, because we're the only ones in the area that have the machine.
Ah, okay.
And so So yeah, I'd like to thank those doctors for allowing me to participate in their patients' care. And we'd go through it, and of course I usually like to see them twice before surgery. So I give them the information, and then they go home and read about it, and then they come back, and if they want to be set up, then I set them up for it, if they're a good candidate, of course.
Absolutely. So after the process, I mean, you talked about, you know, a year later you'll have to be checked to see if anything's shown up again. What happens after the treatment? When does someone need to come back and see you to
So
to follow
usually
up?
I see them back 1 week later and take out the catheter, and we go over things. And then I don't see them for 3 months, because most of them feel like they have no problems. And so at 3 months I check that blood test, the PSA again, and we're usually very happy. It's good news. And then I see them at 6 months, and then usually 1 year. And at 1 year we get another MRI. So the technology advances in imaging have been incredible over the last 15 years. And then if there's a spot the radiologist doesn't like, or either way, we do a repeat biopsy 1 year later. And just make sure that we got it all and there's nothing new.
Okay, wow, it's just incredible technology. How long have you guys had Focal One?
Well, it only got approved by the FDA and Medicare about a year ago. I think we had it about 3 months later in November, and we've been treating since.
Okay, so I mean, is it painful at all? I mean,
No.
you said it's non-invasive, so
they're asleep and they don't complain of pain afterwards.
Okay.
So they don't like the catheter. Nobody likes the catheter,
No.
but yeah. Sometimes catheters, they feel like they have to go like urgency frequency, but usually there's no blood in the catheter, no blood at all.
wow, it sounds like something that people need to be calling you about if it's
That's why I say Star Trek.
exactly.
Because everybody's used to, there having to be a cut or something like that. Yeah, it's really wonderful, and I'm excited we have it.
And so let's talk about some of the other options if maybe someone
Has more aggressive cancer.
cancer.
So,
Can we go through that?
yes, of course. So say like we go over it and there's cancer in several spots, or some of it's high grade. Typically, if they're young and healthy, I tell them to do radical prostatectomy, but that's my own opinion, and I don't do that surgery. And then as they get older and kind of the gray zone is 65, I would send them more likely to get the proton beam or radiation.
Okay.
That's my own personal opinion. I mean, if you ask a bunch of other people, they may say something different. Not saying I had a 50-year-old doctor who wanted radiation, so no problem. And I saw a 74-year-old that wanted surgery yesterday, and I said, well, maybe you're a little too old, but you can go talk to the person who does the radical prostatectomy. So, I'll call it kind of the art of medicine there a little, all right? So, but I mean, usually I give them a whole bunch of information. If they get diagnosed with prostate cancer, I give them a 100 question and answer book, so they can read that. We give them a brochure, Understanding Prostate Cancer. And some families never want radiation, or some families never want surgery. So it's also, you have to individualize it for patients.
Yeah, everybody makes their own decisions.
Yeah, especially because when it comes to cancer or cancer in general, they usually ask their friends and family, and it's kind of a team effort.
Team effort,
and there's some
exactly.
patients I refer to several specialists, for, they're not sure if they want surgery or radiation, so I'll send them to both doctors.
Okay. So a lot to decide for yourself. And tell us, why do you call yourself a quality of life or
quality of life surgeon?
Yeah, tell me about that.
All right. Well,
that's interesting.
Let's say
You took a deep breath.
I mean, I'm not a super serious cancer surgeon. There are people that are. I treat, what I'll call those issues that can occur after prostate cancer therapy or just in life in general. By that I mean troubles with erections or leakage of urine. That's urology, and so those are quality of life issues. So that's kind of more what I specialize in. I don't do the big cancer surgeries or the radiation or stuff like that. So I'm more the smaller, faster quality of life surgeries, including fixing those issues. So yeah.
All right, well, good to know. And tell us more about Focal One and just having this as an option for people.
Sure.
What should people know?
That it is brand new technology, just approved. Some of the younger patients don't have insurance that covers, and so it's because it's so new. Medicare covers, and a lot of insurance companies follow that, but not necessarily all. I would like to reach out to the people in their 70s who have, low volume, low grade prostate cancer, and try to treat them. Like I said, the 50-year-olds are savvy and can get online and read about it. Dallas, New Orleans, and Houston all have it. They're all been academic centers. Believe it or not, Willis-Knighton-Bossier is the first community hospital to have it. All the others were places like MD Anderson or LSU or big academic places, Mayo Clinic and things like that. Duke had it. I actually went to Duke to learn how to do it, and because they were one of the study sites. They had the technology before Medicare approved it, and so that's where I went. That's where I did my training at for this. And but yeah, it's here, and we want to treat people, and we want to do a good job.
Well, congratulations to you and Willis-Knighton for having the Focal One. Yeah, it seems just so helpful and just state of the art. So we have Judith on the phone now. Judith, good afternoon to you. What question do you have?
I have a question for my husband. He wants to know what the year age 82, how that affects this.
Okay,
procedure.
Great question. So your husband's 82 years old. Remember how I was talking about as you get older, there's more prostate cancer. They say 80% of 80-year-olds have at least a little teeny tiny amount. And that's, we have to take other things in. If your husband's, has real bad medical problems, probably wouldn't treat it. But if your husband had a little bit of prostate cancer and we thought it was clinically significant and he's still fairly healthy, this is a great choice for him. So instead of having a big radical surgery, or let's say the radiation isn't really indicated, this would be an easy, fast, simple solution that treats it. Did that help, Judith?
Okay. It did, and you're with Willis-Knighton?
Yes, ma'am.
Okay. And I'm sorry, but I didn't get your name.
That's all right. Dr. Henry. Henry. Henry.
Okay.
There you go. It's on the TV screen. And I want you to know, Judith, I just got a haircut yesterday for this interview.
It looks very nice.
Okay. Thank you very much.
You're welcome.
So,
Appreciate your help.
yes, thank you, Judith, for calling us. So tell us, how do you get men to come to the doctor?
Okay, that's a great one. Typically men in this area sometimes don't want to go visit their doctor, have the stories where, they presented way late with the cancer. But yeah, usually the two things that drive them are, typically if they can't get an erection, that will bring them in, or they can't pee, that will bring them in too. So yeah, no, those are, and then of course we evaluate them for other things.
Okay. Oh, okay. Yeah, that's a good point. Okay, we have Donald on the phone. Donald, what is your question?
I'd like to know, what are the PSA numbers for?
Go ahead, Donald. You want the PSA numbers for? Typically, it's for age. When you're younger.
Well, I want the number that I want the number that becomes a threat to
Sure.
me. Is it
Yeah, that's what.
over 4, over 5,
Yeah,
over 6?
traditionally, you're correct. Traditionally, the
If I'm
magic number is
70-some years
4.
old.
And you're how old?
73.
Yeah. Usually in the 40s, and I'm not saying every lab's the same, above 2.5 is considered high. And then when you get, more into your 50s and 60s, we say 4 is the magic number. And then when you're 70s, maybe 4.5 or 5, depending upon the laboratory and where you are in the country. But if you're in your 70s, most people would say above, depending upon where you are, 4 to 5 would be considered elevated.
Well, I'm a 7-something now, and I was asked to come in and get some prostate samples.
Yeah,
Would
biopsy.
that be a good thing for me?
Well, what is your PSA?
PSA was 7.4, I think it was.
Yeah, well, I assume they repeated it. Did they check it one more
checked it
time?
again, yes.
Yeah, all right.
Yes.
And then, they would also do the examination of your prostate. And, but yeah, that's, and if it's, that's considered elevated. Unless there's some unusual factors, most people would probably biopsy with above a 7 in your 70s. Yes, sir.
Well, would you have one yourself if that was your case?
Yes, I would. As long as there's not an infection, inflammation, pain, or anything like that on urinating. If this has been, you've been checked a couple times, and like I said, there's no inflammation or infection. Yeah, you probably need to be biopsied. Yes, I would. Both my grandfathers had prostate cancer, so I'm considered high risk because it's in my family. People of African American descent have a higher risk factor. They're considered, ones that need to be screened at 40. So both myself, I had to start getting my PSA every year at 40. But yeah, if I were you, and if you don't have any troubles, with pain or burning or anything like that on urination, then you probably do need a biopsy. There's other factors we can look at, but just from what you're telling me, yes. Did that help?
Thank you very much.
You're welcome, sir.
Thank you, Donald. Wow, that's some good information there. So, yeah, can you tell me the symptoms of prostate cancer? 0?
Until it's too late.
Wow.
Yeah.
Okay. So,
Yeah, that's why we want to screen people, is catch them while it's early.
And so what are the ages again?
Well,
It depends-
family history
depends on your
or
family
African American, age 40, neither of those age 50. It's very, very high rate frequency here in Shreveport area.
Why do you think that is?
Diet and genetics. There's some loose data saying red animal fats. So, hamburgers, bacon, things like that. Yeah.
Yeah, so diet can be
sure.
a contributor there.
Yep.
Okay, so yeah, we've gotten some good questions. Thank you, callers, for chiming in with us and joining in on the conversation.
For sure.
And again, Focal One,
Yeah,
that
great.
is something amazing. That is
Think
that
about
is helping
something-
people out there.
Yeah, melting it without any cuts or incisions.
And definitely consider your family history
Yeah,
for prostate
yeah,
cancer.
Oh, yeah.
And come see Dr. Henry. Tell us where you're located again.
I'm at Willis Knight and Piermont, and at Bossier. Willis Knight and Bossier, both places. And it's I have a nurse practitioner who does a great job, and I have a partner who does a great job too, and we're happy to see people.
And what is your phone number?
212-7335.
Okay.
212-7335.
Okay, so you guys give Dr. Henry a call if you weren't able to call in today. And yeah, we want to fight against prostate cancer and live a happy, healthy life. And thank you all for watching Healthline 3 today. Have a great week and stay hydrated out there in the sunshine.